Thanks for staying with us. Tomorrow marks World Health Day. This day is celebrated on the 7th of April, and it also marks the 75th anniversary of the World Health Organization. And with this year's theme, which is Health for All, the World Health Organization is creating an opportunity to look back at health successes that have helped improve the quality of life over the last 7 decades. I'm now joined by Dr Zena Malinga, a dermatologist who's passionate about what they call patient-oriented skin management. Dr. Malinga, thank you so much for your time. Now, on a day like World Health Day, if you look at the last few years and what we've been through as a world body, you'd think, oh, skin is the last thing we should be worrying about. We've got far more serious things to talk about. And yet, this is the thing that we all have in common, and it faces so many stresses on any given day. It really needs more attention, and I'm sure, as a dermatologist, you would agree. I want to ask you, however, is there enough awareness about the fact that what we put into our bodies has a big impact on what comes out of our pores?
Good evening to you, Marcel, and good evening to your viewers. Thank you so much for having me. There absolutely needs to be more awareness on skin and skin health. And to your point, what we put into our bodies has a great effect on what shows on the outside. So our skin is the largest organ, and it's an interface really with our environment, and it has so many different functions. So what we put into our bodies, what we eat, what we consume, what we may smoke or drink can absolutely show up on our skin. Even other conditions or diseases that are inside have a way of showing up as signs and symptoms in the skin, and that's really what we focus on as dermatologists when we examine our patients, is looking at the skin as a window into our patients' bodies so that we're able to diagnose them accurately and manage them well.
What is your pet peeve as a dermatologist? I think you'd probably agree that just because you can afford the most expensive moisturizer doesn't necessarily mean that it's going to have the best results. The one doesn't go hand in hand, does it? What is your biggest pet peeve, and what is your one bit of advice you normally give people when it comes to skincare?
So, Marcel, I mean, I wouldn't say it's a pet peeve, but there are gaps in knowledge that I would say that people have. So the first one really, and I think it's very important that I bring this across, is that nobody needs to have a 10-step skincare routine.
Who's got the time?
Absolutely. So with social media, with TikTok and all the other platforms, you find that people are using many different products on their skin. Sometimes they're applying products that aren't compatible with each other, and this is causing a lot of irritation and sometimes causing unnecessary disease and pathology. So I would say, if I were to have a pet peeve, it's really excessive use of unnecessary topicals on our skins.
But don't you think that that speaks to the fact that we are just dying for information? I mean, if I think about my circles of friends, especially as women, because the market is very much focused on women, when men actually should be taking care of their skin more seriously as well. I'm sure you would agree. But it seems the information and the products and the things that we do, firstly based on what our mothers taught us when we were growing up, if we're lucky enough to have a mother or a grandmother or an aunt who's into that kind of thing, and they tell you, use this, don't use toner, or until you're old enough to make your own decisions. And then your friends say, I'm using this new night cream, it's amazing. Or when you hit the 40s like I did a few years ago, oh, we need to start using masks, use this. And another friend says, no, don't use that. Oh, look at this blogger, she just did this. So don't you think that speaks to the fact that people are just dying for information?
Absolutely, Marcel. I couldn't agree with you more. I do think that the pillars of a really good skincare routine or good skin health are to have a focus on simplicity, cleansing the skin with a gentle cleanser, moisturizing the skin to maintain the barrier, and protecting the skin with a sunscreen that has that has an SPF of at least 30. And then additional steps should be individualized, right? So if you have a particular concern, then you should focus whatever products you buy or products that are prescribed onto that. And if you have a skincare disease, if there is something that runs in your family, if it's something that's genetic, if it's inflammatory or infectious, then the treatment that you apply should be focused on that product. There isn't a blanket treatment for everyone. There isn't a blanket routine for everyone. Skincare should be individualized.
Can I ask you, however, not everybody perhaps feels that they have the access to see a specialist like you, like a dermatologist. They might not know that it is covered by the medical aid, or they may not have medical aid at all. Do you think a public health system puts enough of a focus on skincare? And are there specialists within the public health system that people can actually access, but they just don't know it?
So absolutely, Marcel, there are dermatologists within the public healthcare sector. In fact, all specialists train through public hospitals, and if you go through the particular referral pathways, you can see a dermatologist in a public hospital. It would mostly be at the tertiary level. However, dermatologists do outreach where they go to primary healthcare facilities and offer services. I think it's also important for people who don't necessarily have access to ask questions about their skin, ask if there is a clinic that has a dermatologist, ask if they're able to be referred, if they're not seeing any improvement, or if a consultation can be made with a dermatologist in the drainage area.
Let's talk more seriously, however, about the issue around skin cancer. You were recently involved in research at the University of Pretoria and a paper that was recognized at the annual Dermatology Congress, and that focused very much on skin cancers. And I believe you're quite passionate about the research space. And the question I have for you about that research space is, how key is it for more research to be done on the southern tip of Africa to fuel how we understand our skins down here, as opposed to the information that we're getting through big skincare businesses that perhaps base all of their products on research that they are gleaning from European markets?
So absolutely. So Marcel, my research focused on basal cell carcinomas, which is the most common type of skin cancer in South Africa, and I was really looking at inflammatory markers and certain immune markers in this form of cancer. And what we were aiming to do is to see if it's any different from what is seen around the rest of the world, and if we're able to bring on board new treatments that can assist in us treating these patients without having to perform surgeries that might be disfiguring or remove large amounts of skin when we're removing these cancers. When we speak about research, there's always a need for more research. There's always a need for ongoing exploration of diseases and pathology as they evolve, so that we as practitioners can offer the best standard of care for our patients.
Just one last question before I let you go. Do you think that within our communities there is enough of an understanding? You know, there's the saying that we hear all the time when we were growing up, you know, black don't crack. So I don't need to use this FPF, and I don't need to, you know, do this, that, and the other. And that's for other people who are light-skinned and they must stay out of the sun and you know, that kind of thing. Do you think that there is enough of an awareness? Is it something that perhaps the newer generation is coming up with, saying that I still do need to use do need to use sunscreen, I do need to take care of my skin, I can't just depend on genetics, because skin cancer or skin issues can affect anybody, can't it?
Absolutely, Marcel. I cannot stress enough. I would be amiss as a dermatologist if I left this interview without stressing the importance of using a sunscreen with an SPF of at least 30.
And even in the winter?
Even in the winter, rain or shine, hail or snow, you have to use a sunscreen. Sunscreens protect us from the harmful effects of the sun, the UV radiation, which can cause premature aging, which can cause precancerous and cancerous lesions in any color of skin. So whether your skin is very fair, whether your skin is very dark, everybody should be using a sunscreen.
And if there's something on your skin that's bothering you and it wasn't there 2 weeks ago or even a month ago, have it checked out by a healthcare practitioner.
Anything that, so we usually use the A, B, C, D, E criteria. If a mole is asymmetrical, if the border is irregular, if there's a change in color, if the diameter is more than 6 millimeters, so that's larger than the diameter of a rubber and eraser on a pencil, and then if there's evolution, so if your mole changes from what it normally looks like, you'd want to get that seen to by a dermatologist. But also, most adults should have their skin checked at least once a year, just to make sure that there isn't anything suspicious. And if you notice a rash, pain in your skin, redness, any changes in your nails, as well as in your hair, in addition to the skin symptoms that I've mentioned, you should consult a dermatologist.
I think there's some interesting conversations happening on the couches now, families or couples watching and saying, listen, that thing I felt on your back, let's have a look. It might be an interesting conversation starter, and hopefully not something serious. Dr. Zena Malinga, thank you so much for coming in to help us mark World Health Day in a different way, in a bit of a change of speed. So we really do appreciate your time.
Thank you so much for having me, Marcel.
Okay, that is Dr. Zena Malinga, a dermatologist, speaking to us just ahead of World Health Day being marked tomorrow.